way that HIV is spread. But also there are other ways, such as blood transfusion, when some people might need to receive blood transfusion for a medical operation, but then if that blood that's being transfused is blood from an infected person or an infected patient, then the person receiving the blood has almost a 100% chance of receiving the disease. But then this is quite rare because doctors, they usually check the blood to see if it's safe, but then there have been a few mistakes in the past. And childbirth infection is responsible for 0.1%. And this is also very rare because nowadays, when an AIDS patient or an HIV patient who wants to have a child, so a mother who wants to have a child, when a mother wants to have a child, in the past they couldn't because there was a high risk of the baby receiving the disease because a lot of blood is lost during childbirth, and then so the child could be exposed to blood. But then now with new technology, it's possible to just take the baby out using C-section, cesarean section, and with a careful procedure, doctors can make sure that no blood lands on the baby, so they can make sure that the baby is not exposed to any blood. So this is why childbirth infection is rare, is rarely responsible for HIV and AIDS infection, but it still is 0.1%. And then finally, drug users. In Korea, it's almost 0%. So basically, people are contaminated through sexual activity in South Korea. And this problem is like an iceberg problem, because an iceberg, right? When you're at an ocean and you see an iceberg, you might think that the iceberg is very tall or very big because you can see it rising out of the surface and you can see it tip. But then most people don't realize, well, many people don't realize that an iceberg is even deeper at the bottom. So let's say if this is the ocean, the iceberg might seem big here, but the iceberg goes a much greater distance down. So there have been 6,120 confirmed HIV-infected patients in South Korea, but people estimate that there are approximately 61,200 people who are unconfirmed HIV-infected patients. And the reason why there are so many unconfirmed HIV and AIDS patients is because of stigma, of bias and discrimination. Because, to take an example, in the United States, it's a Western culture, so yes, HIV and AIDS is a serious problem, and AIDS patients in the United States do receive discrimination, but then it's more of a free society, so HIV and AIDS patients, they can still tell society that they do have the disease, and their family won't abandon them, for example. Their family will still be there, and their friends will still be there to support them. But in Korea, it's a highly closed-minded society, so if an AIDS patient tells society, or if society finds out that an AIDS patient has AIDS, then that person basically faces extreme bias and discrimination, and that infected person is treated as a sinner or as a criminal. And so oftentimes, well, I'll show you this later, but oftentimes the family just deserts them or abandons them. And if they're married, then the wife always seeks for a divorce because she doesn't want to be associated with a sinner. And if that person has a job, then that person, even though it is illegal to fire a person just because that person has AIDS, oftentimes the employer will pressure that person to give up, and all the employees will go along with the employer and pressure the person to give up. So that person will basically be stranded by himself or herself with no means of survival, no means of caring for him or herself, because he or she might not have a job and might not have a family who will support them. And so because of extreme bias and discrimination, oftentimes HIV and AIDS patients in Korea, they don't tell their family and they don't tell other people that they have the disease. So that's why there's such a small number of confirmed HIV-infected people. But people expect that there's a greater number who are unconfirmed. So now I'll talk about several ways of spreading HIV. And as mentioned before, sexual activity is one way of spreading HIV and AIDS, but also blood transfusion is another way, because when blood is directly injected into the bloodstream, when infected blood is directly injected into the bloodstream, then, as you know, the infected blood will mix in the person's body, and then that person has a great chance of receiving AIDS. And another method of blood transfusion is through injected drug use, so injection of drugs, because when the blood of an infected patient enters a needle, and then that needle is spread around the group of drug users, then that entire group can be infected. And finally, childbirth infection. So a baby might be born or might be exposed to infected blood through childbirth. And also, breast milk is a way of spreading HIV and AIDS to children, young children. So these are some ways. And there are several dangers of HIV infection. Well, not several dangers, but several types of people who are at risk, who are especially at risk. Homosexual people are especially at risk of receiving HIV and AIDS. And I'll talk about this later. And also bisexual men, drug addicts who use needles, hemophilia patients, and medical workers. These are people who are especially at risk of HIV infection. For example, medical workers are at risk because of course they'll take precautions to be safe. They'll oftentimes wear double gloves. They'll wear 2 gloves to make sure that they're not exposed to any contaminated blood. But accidents do happen, and when medical workers try to take care of AIDS patients, sometimes something wrong happens and then they become infected. So these people are especially at risk. So now I'll talk about the probability of ways of HIV infection. To explain it, I'll talk about, for example, when you use drugs, what will be the probability of you contracting AIDS? So basically, to start with drugs, if you use drugs through shared needle use, there is approximately a 1% chance that you'll get AIDS or HIV by doing it once. But if you repeatedly do drugs, then the probability increases until it's almost certain that you'll get the disease. And childbirth infection, there is a 25 to 30% chance that you'll get AIDS. And a direct blood transfusion, there's a 95 to 100% chance, because it's basically just pouring a large volume of infected blood into your body. So there's almost a certain chance. And sexual activity, it's kind of unexpected, because even though sexual activity is mostly responsible for HIV and AIDS in Korea, 99% of the people get it through sexual contact, the probability that you'll contract it by having sex just once is actually very small, 0.1 to 1%. But then when people keep doing it, the probability increases. So even though the percentage is small, you should still be careful. So now these are just some ways that if you do them, you will not contract HIV. So to explain, people think that by kissing an AIDS patient, you will also receive the disease, but this is not true, because AIDS is spread through the transfer of infected blood. And so kissing an AIDS patient, just because you kiss an AIDS patient doesn't mean you'll get the disease. And also hugging, handshakes, eating together, mosquito bites, etc. All of these will not make you contract the disease. But these are some common misconceptions. But nevertheless, you need to take some precautions when you're living with an AIDS patient. Or you should just take these precautions in general, because you never know. So share toothbrushes. You shouldn't share toothbrushes, and you shouldn't share razors, because these two ways facilitate the transfer of blood. And so these are good precautions to take. And then this is the structure of HIV, but I'm not going to get into this. All you have to know is that HIV looks like this, and it's a virus. So the mechanism of HIV infection, basically HIV is a virus cell. So as I explained before, when HIV virus cells enter the human body, they basically destroy the human immune system. So they destroy the white blood cells and the C4 positive cells, the immune cells of the body. HIV virus cells destroy the immune cells so that gradually the person infected will be unable to fight off disease. And how this happens is HIV virus cells take control, grab onto immune body cells, and then after grabbing onto the immune body cells, they turn that immune body cell into a virus cell. So basically the virus destroys immune body cells and at the same time makes copies of itself. So the virus makes copies and destroys the immune system until the immune system is destroyed. So this is what I talked about. So this is a graph that shows the progress after HIV infection. So this shows what happens to you after you're initially infected. So when you're first infected, you won't see any symptoms, so you won't know that you have HIV. But then a few weeks later, approximately 3 weeks later, you'll see some symptoms. But then again, these symptoms are common symptoms, such as the flu. You might get a fever, or you might cough a lot. But then most people don't know that they have HIV because, once again, these are common symptoms. But then after about 3 weeks of infection, you start to see some symptoms, some everyday symptoms. But then after you see those symptoms for a few weeks, there won't be any symptoms for a period of about 10 years. So after you're infected and you see a few common symptoms, you won't see any symptoms at all for 10 years. So there's basically no way to know whether you have the disease unless you test for it. But then people don't get tested for it because there's no symptoms. So you won't see any symptoms. So people basically just live on their normal lives. But then after a period of 10 years, they start to see symptoms again. And I'll talk about these symptoms later, but they slowly start to see symptoms because by this point, the immune system is heavily broken down. And then a few years after that, the patient will most likely become infected from other serious diseases because that person will have a highly weakened immune system. And after that, that person it'll eventually result in death because they won't be able to fight off disease. So like I said, after 1 to 6 weeks after infection, you'll start to see symptoms like fever, chills, and throat pain, etc. And then for 8 to 10 years, there are no symptoms. But then after that, there are symptoms again for 1 month. And then after 10 more years, other diseases such as tumors or Alzheimer's disease start to appear because by that point, you basically don't have an immune system. So and these are some of the symptoms that you see after you become infected. But then as you can see here, well, you can't really read it, but it says fever here, and cough, nose and throat pain. A lot of these problems are everyday problems or everyday symptoms. So people usually don't associate these symptoms with HIV. So they don't get tested for it because they don't know that they have it. But this is exactly why HIV is dangerous, because it can infect other people and that person won't even know that he or she has it until it's too late. And by that point, it's too late. So this is why HIV is such a serious problem and why it can infect so many people. Because when an HIV patient has HIV, has the disease, and like I said before, that person will not have the disease, so that person will live about